All right, well, let's jump into some segments. So first off, this is a pretty interesting segment about physician addiction to different substance abuses. And we did one similar to this, I think like a year ago. I can't remember exactly how we phrased it. It was something about problem physicians, and I think maybe we delved into this a little bit.
Yeah.
But this is I want to do a whole segment on it because there's actually a new study out, and it has some interesting information in there, and so I thought we'd kind of go over it. So as people probably are aware, America does have a bit of a substance abuse addiction issue. At any one given time, there's about 47 million people per year diagnosed with substance use disorders.
Right.
And that could be, alcohol, drugs, prescription drugs, illicit drugs, all that kind of things. So that's like 17% of the population at any given year that has currently using or has a substance, is defined as having a substance use disorder, which is more than just like once in a while use.
Yeah.
Right? I mean, if you drink like wine with dinner a couple nights a week, then obviously you're not going to be included in that. Right?
I would be then.
I know, it'd be 100%.
Yeah.
It'd be 100%. So that's a pretty high number. And of those 47 million, only about 6% get treatment. So, it's kind of an issue in the United States. It's just one of our things that we have because people have money and access to these things. It does become a bit of a problem. So there was a recent study by the American Addiction Centers, which is a group that looks into substance abuse, and they took a deep dive into specifically physicians and the kind of rates of addiction and actually some of the characteristics of different specialties, which I thought was wildly interesting. I learned actually quite a bit by reading this. So most of the research says that over the course of their careers, 10 to 15% of physicians will have a substance use disorder.
Okay.
Which, I mean, and so I tried to like equalize those numbers because the first number about, general Americans was a number per year. And so I kind of did the math and figured it out. So for a given, career span, about 14% of Americans have a substance use disorder. Okay.
Yeah.
And for physicians, depending on which study you look at, is 10 to 15, which means, if you average that out to say 12.5 or whatever, physicians are kind of on par with the general public as far as having substance use disorders, or maybe slightly less.
Okay.
So I don't know. What do you think about that? I mean, if you said, okay, would a physician be more the same or less likely to have a substance abuse disorder? What would you think?
I don't know. I mean, doctors, depending on what type of job I guess you have or specialty, it's very stressful, and then they're around all of the drugs. Right,
exactly. I mean, you're hitting all the points I'm about to talk about. Well, I mean, I would have figured that it probably would have been about the same, roughly. You might think that it would be less because, you hope doctors, because of all the rigors it takes to get into med school and residency and all that they might be a little bit less likely to get caught up in substance use disorders. And also to the risk, if a physician gets caught, using drugs, like they can lose their license.
Right.
And so, that's a really big deterrent because you can't just easily go and, do something else, right? Like if you have a job and you get caught doing drugs or whatever, you lose your job. I mean, you can get another job, but physicians, it's hard if you lose your license. So on the one hand, you might think that it would be lower, but then on the other hand, it's the same. It's the exact things you literally just said.
Yeah.
It's a stressful job, and a lot of doctors have access to these drugs, and so that equates to some of these people getting caught up with substance use disorders. And I would also point out that I think that there's a lot of functional people out there that have some substance use disorder. I mean, these aren't people that are like in the gutter, like hanging. Oh, but we didn't throw up my picture. Sorry, hey, Jordan. Yeah, we throw up the picture. I made a picture.
An AI one.
The intro. Yeah, the intro one.
That guy, dude.
Sorry, Jordan. Normally, Travis throws these up when I kind of get rolling, and I forgot to tell you that. But anyway, yeah. Did you like that one?
That guy's head looks like a thumb.
Yeah, I think he's bald, but I don't know. Yeah, that's another great AI creation on my part.
Beautiful.
Anyway. So I thought of that when I talked about the guy. So yeah, I mean, I think that there's probably with physicians a lot of very functional physicians that might have a substance use disorder.
Yeah,
where, like
definitely.
when they're when they're not working or on call, they're drinking or doing drugs or whatever. I thought that it was pretty interesting that this study looked into the different characteristics by specialty. And I actually, there was a couple things that I kind of, well, one for sure that I knew, two maybe, but then there's also some information that was totally new to me. So I'm going to ask, I was going to ask you and Travis, but Travis not here, so I'm going to ask you these questions. So
okay.
Don't feel bad. A lot of these are very, like, they make sense, but you might not necessarily know them. So,
okay.
All right, I'm going to throw up that first question, Jordan. All right, so which specialty has the highest rate of fentanyl and IV drug use? What do you think? Cardiologists, OBGYNs, anesthesiologists, family medicine. And so...
Cardiology.
That's not a bad guess because they do sometimes use those drugs, but it's mostly about the access.
I would say if it's not A, then C.
Yeah, you're right, yeah. So anesthesiologists have a much higher rate of IV drug use, including fentanyl. And the reason for that, well, there's two reasons. One is they have easy access. No one uses more fentanyl than anesthesiologists because they use it in surgery for anesthesia, right? So they have easy access to these drugs. I have no access to fentanyl as a surgeon, really. I mean, I never, I guess I write orders. I don't even write orders for fentanyl. I write orders for morphine, but like I never touch the drugs. Like I don't even know where they store the stuff, right?
Yeah.
So I don't really have easy access. But anesthesiologists, on the other hand, they always are using it, and so they do have an easy access to it. And also, there's a study out there that says that possibly the secondhand exposure to the anesthetic gases causes a reward trigger system in their brains that makes them more likely to use IV drugs. I'd never heard that before. When I was reading the study, it mentioned that. It is kind of interesting, right? Because it's like a secondhand effect of the anesthetic gases, which are, an anesthetic. So, yeah, but so about 40% of anesthesiologists who have to go to doctor rehab are there for IV drug use, which is a pretty high number compared to other specialties.
Yeah.
And that one does make sense. I mean, it's all about access. So, all right, next question. So, what specialty has the highest rate of alcohol abuse? Surgeons, internal medicine docs, radiologists, pediatrics. I didn't know this one myself, Sarah. So don't feel bad. Like I know I always put you on the spot, but like no one's gonna necessarily know.
Surgery.
You are absolutely right. Surgeons far and away have the highest alcohol substance use disorders, and they also are very likely to use tobacco products, like cigarettes or whatever. Which I didn't know that. Like yeah, it's really and get a load of these stats. So the risk of the average American having an alcohol substance use disorder is 6.2%. Okay, so 6.2%. Remember that number. The average risk for a male surgeon is 14%.
Oh.
It's like over double. Female surgeons, 25.6%. According to this data, 1 in 4 female surgeons has an alcohol use disorder.
Like, yeah.
That's crazy. I did not know it was that high. Like, I may have to go down and break that data down. Like I was reading, I was like, is this right? Yeah, so very interesting. Surgeons very likely to use alcohol to excess, and especially female surgeons, almost by a double rate over males, which is double over the general population. Pretty wild stuff. All right, next one. All right, what specialty has the highest rate of benzodiazepines? So benzodiazepines are like Xanax, Valium, Ativan. This one kind of makes sense. I would not have known this, but then when I read the answer, or when I was reading this and it said that this specialty had it. So it's family medicine, psychiatry, emergency medicine, OBGYN.
Psychiatry.
You are 100% correct. Good job, Sarah. 2 for 3. That's really good. And the reason that makes sense to me is the psychiatrist very often prescribes those drugs because they're seeing a lot of people with anxiety or other issues where benzodiazepines are helpful. And psychiatrists are more prone than other specialties to have stress, burnout, and risk of suicide.
Really?
Like, yeah, they think it might be because that specialty has to deal with so much mental health issues that it starts to affect their own mental health.
Yeah.
I mean,
I remember growing up that people always told me that dentists have a high rate of suicide.
I've heard that too.
My dentist, when I was a kid, killed himself.
Really?
Yes.
Wow, that's crazy. Well, and we've talked about this a couple times in some different segments, that physicians in general have a 2 times suicide rate over the general population.
Yeah.
Which is crazy. I mean, that's just kind of mind-boggling to me. I guess it's just, a lot of stress-induced or, subclinical
Yeah,
mental
like they're like,
or...
well, I could see, like, I mean, my brain is like, oh, it's the weekend. I'm going to have a few drinks to, like, decompress.
I'm like, it's the weekend. I got to do surgery.
Yeah. But, like, I don't know. I could see how doctors or,
I could see how people get burned out. I think probably, if I had to, like,
You
maybe...
could see you are a doctor.
Well, yeah, I mean, I work a ton, but I don't mind working, and, I like what I do. So even though I'm working, like, I'm not, unhappy. I do get a little bit burned out, but I think what happens is that people get burned out, and then that burned out feeling turns into depression. And then once, that's like the biggest one.
And then they try to treat it with whatever is
that's
around
when
them.
So we talked about this just a few segments ago. Absolute biggest risks for suicide are, well, one, history of previous suicide attempt. That's like number one. But then substance use disorders, and then history of depression or other mental illness. Yeah. So, so psychiatrists they need to take care of themselves. They're at risk. Okay, let's go to the next one. I didn't know this one either. I don't know, when it came up, I was like, that makes sense. All right, so what specialty has the highest rate of going to rehab over any specialty, and also the highest rate of illicit drug use? So like street drugs, like marijuana or cocaine or whatever. So family medicine, internal medicine, emergency medicine, OBGYN.
Emergency medicine.
You're so good. You're 100% correct. So emergency medicine. I wasn't sure if I knew this. Like when I read it, I was like, okay, maybe I knew that. So they do have the overall highest risk of substance use disorders, which reflects in the fact that emergency medicine makes up 3% of all physicians, but they make up between 8 and 18% of all physicians who have to go to rehab. So they have a very high rate of substance use disorders, and also a higher rate of using like illicit drugs. Like surgeons, are drinking, psychiatrists using Valium. And of course, that's all generalizations. It's not 100%, obviously. But yeah, they have a higher rate of illicit drug use. But it kind of makes sense. Emergency medicine is a specialty with a very high burnout rate. Yeah. I mean, it's stressful, and can be a thankless job. And I totally see how they can get burned out, and that oftentimes will lead on to substance abuse. So I guess we need to hug our ER docs.
Yeah, I'm sure, and they see a lot of things that
we
don't want to see.
Them. Yeah, they do. Yeah, that's true as well. Yeah. All right, I got one more question. So, what specialty has the lowest risk of substance use disorders of the specialty? So we got pediatrics, radiology, GI medicine, OBGYN.
I don't know, that's hard. I mean, I have never seen GI medicine up there.
I know,
dang. I'm just gonna say pediatrics.
Good job. You went 4 for 5. That's really impressive. Yeah, it's pediatrics. I don't know if I would have gotten 4 for 5. Some of those I definitely didn't know. Yeah, so pediatrics of all specialties has the lowest risk of substance use disorders, which is interesting. I mean, I don't think that is the least stressful specialty at all, honestly.
Maybe they get rewarded better when they help a child.
Yeah, maybe so. But yeah,
I could see that.
I thought that was very interesting that of all the specialties, pediatrics has the lowest risk of substance use disorders. And then the last thing I just wanted to kind of talk about this segment was, although physicians do have about equal risk of substance use disorders, they have a very, very high success rate if they go to rehab. So if a person has substance use disorder, they go to rehab, it's like about an 80% success rate, which is much higher than the general population. And I think that's just purely related to the financial repercussions of having a problem. And if somebody has a substance use disorder and it starts to affect their job, I mean, it's a huge financial loss to them. And so I think that makes people or physicians very motivated to successfully complete like a rehab program. Yeah. So, yeah. All right. So I just want to recap this segment real quick. So today on Nip Talk, we did a segment about physician addiction and substance use disorders, because a new study came out by the American Addiction Centers that dived into all of the data on physician substance use disorders. And On average, a physician has about the same or a slightly less risk of having a substance use disorder versus the general population. Some people might think that it would be lower because of the high risk to their profession and also that physicians should just know better. But then again, physicians do have high stress jobs and they also have access to a lot of these substances that are being abused. It went on to have some very interesting data about the different specialties. It found that surgeons had the highest risk of having alcohol substance use disorders, and interestingly, female surgeons had a twice as high risk of having alcohol substance disorder versus male surgeons. It also talked about how anesthesiologists had the highest risk of IV drug abuse, such as fentanyl. Talked about how psychiatrists had the highest risk of benzodiazepine, things like Valium use disorders. It also talked about how emergency medicine overall had the highest risk of having abuse disorders and also the highest risk of illicit drug use. And then pediatrics, interestingly, had the lowest risk of substance abuse disorders. And also, just to end on a happy note, if physicians do have substance use disorders and they go into rehab, they have a very, very high rate of that being successful. So some pretty interesting data out about physician addiction. If you want to check out the full segment, just follow us back to the Nip Talk YouTube page and check it out. So.